Welcome to the Surviving to Thriving podcast with Jim Squire. I'm a licensed psychotherapist here in Toronto, Canada, and this is actually my 11th episode. The title of this episode, or the topic we'll be addressing, is Understanding Trauma. And it's a very common, much more talked about, I think, lately than in the past, which is very positive. I've been a trauma therapist for many years. I do work fairly regularly with people that have been traumatized. It is one of the most challenging areas to work in mental health. It does take quite a bit of training, but it is very rewarding and certainly very necessary because there are an awful lot of people out there that are not able to function, not able to live the way they would like to because of unprocessed, unhealed trauma. So I'm going to start off by just giving a general description. Trauma is basically a response to a distressing event. And one of the things I think a lot of people struggle with is not understanding that two people can experience the same situation, and yet one can become traumatized and one won't. And there's many reasons for that. So what we never want to do is judge whether someone should have been traumatized or whether they are traumatized based on how we perceive the event or situation. So there are people that differentiate between what we call big T or small t in trauma. I don't tend to do that because I feel that in some cases it can just invalidate people, invalidate their experience, which is not something we want to do. So most people are fairly familiar with PTSD, post-traumatic stress disorder. It's a commonly used term. And there's also another term that's very similar called CPTSD. So it's complex PTSD. Typically, the difference is PTSD will have one or two events. CPTSD would be something more typical with a childhood trauma, something where they were in an abusive family, and there was multiple events. So that is a bit more challenging to work with because you're not looking at sort of a specific, like a car accident or a mugging or something that took place. You're looking at, sometimes over many years, multiple traumatic situations. And certainly the way to approach those is quite different. Most people that go through a traumatic event, especially one where they feel they may not survive, will have typical sort of trauma responses for usually roughly 30 days or longer. And I'll list some of what those are. Typically, people will have what we call a startle response, a sound or some sort of image, or will trigger a startled response in their system. They'll often have nightmares, trouble sleeping, inability or troubles relaxing. They often will be irritable, angry, or just feel numb. Depending on the type of situation, sometimes people can feel that they should have done something differently, so they might be overwhelmed with guilt or shame over some action they did or didn't take. Now, typically what we see is a gradual diminishing of this over time. And what we typically understand something like PTSD to be is an easy way to understand it is it's what we call a failure to recover. It's not something that you get, in a sense. It's something that the traumatic event has happened and you have not recovered from it. So sometimes many years later, you were still reliving the event, experiencing it like it might have happened yesterday. And that's why we like to refer to it. I think it helps people understand it's a failure to recover. Because as I said, most people who experience something traumatic will, in a period of weeks, usually around 30 days or something like that, will notice a subsiding of symptoms, will notice themselves returning to some sort of normalcy, in a sense. So I thought I would just go over a bit about what kind of happens when you're traumatized. So after you've been traumatized, typically we have something called the amygdala that is kind of it operates and sort of oversees the fight or flight part of our system. So one of the problems sometimes and why people don't understand why they react a certain way is that there's the thalamus is typically the area that is sort of overseeing the sensory input. So if you're walking somewhere or doing something, your senses are going to pick up something that the thalamus is going to identify and send this information to the amygdala, which is going to respond to it like a threat. Now, it could be something minimal to someone else's perception. But the point is that it bypasses your prefrontal cortex. So it bypasses your thinking, the thinking part of your brain. So the idea that you can sort of like stop that reaction or catch it when it happens or think through it in that context is not really possible because it's bypassing. And there's a reason for that, of course, from survival perspective. Obviously, responding very quickly to something is in their best interest from a survival perspective. Taking time to ponder and think and evaluate could make the difference between you surviving or not surviving. So from an adaptive survival perspective, that makes sense. So when that's happening for people, and it could be a sight, could be a sound, could be some type of scent of some kind. There are many things that can take place that would trigger the senses and trigger this sort of reaction. So people that have had fairly serious trauma will have a sort of a reaction to a triggering response to one of these sensory inputs in a way that was similar to, of course, when they were initially traumatized. They will feel overwhelmed. They will usually feel a very visceral reaction. Their whole body kind of reacts a certain way. Your nervous system is triggered. Things like the hippocampus the amygdala will work with the hippocampus to release, cortisol, adrenaline, some of the hormones that get your body into the fight or flight place. The problem, of course, is that in most cases, these things are being triggered when there isn't really a threat. So obviously a person is not coping very well with life in these situations. Depending on what the initial trauma happened, could be what we call an interpersonal trauma. Someone could have harmed them in some way. Could have been, say, in a car accident, something. So there's many, many ways that through the sensory input, you can be triggered. And depending on how the initial trauma took place, that can manifest daily in some cases, or it could manifest very infrequently. It's still quite distressing for people. So part of the work typically is to be able to get to a place where you can feel safe, because that's at the core of what trauma is you're feeling unsafe. You're feeling in some way that your survival is threatened. In some cases, you could feel that you're not going to survive. So the key focus of the work is helping people find ways be able to feel safe. Someone who's had, say, traumatic childhood would typically be in a heightened stress response. It could be in a heightened stress response all the time. They could be edgy, irritable, prone to emotional outbursts because of not being able to, in a sense, bring their system down to a calmer, safer place. So typically when therapists work with people, they will get them to rate how they feel on a scale of 1 to 10. Usually with trauma, I will ask people to sort of out of, one being almost asleep and 10 being as overwhelmed as you've ever experienced, how does this feel right now? And usually people will rate it around, their experience is 6 or 7 or 8 or something like that. It helps us kind of gauge because we don't want people getting to a place of being, a 9 or a 10, of course. So one of the things that's sort of known in common sort of knowledge about trauma is that, and sometimes people would just throw this around, oh, I'm re-traumatized, but it is something that can happen. One of the things we have to be very careful of when we work with trauma is that we don't, start going over past events and allow a person to get so overwhelmed they can actually re-traumatize themselves through reliving the event or thinking about the event. So we have to be very careful of how stimulated or activated the person's nervous system is, because that's really where a lot of the work is in terms of keeping them safe, is to making sure we can sort of work through this trauma, process it, but keep them in a place where they're able to cope and they're managing. So typically what this looks like is, I would say, if I was the client and I was recounting a story, the therapist would start to notice that I was becoming quite activated or agitated, and would ask me to pause, take a few deep breaths, check in with me, see how I'm doing, and if it seems okay, I could proceed. If I have gotten too overwhelmed, then we would stop and we would talk about something else, and we would proceed at another time. It's very important, at least from the perspective that I work, that we make sure that we are very aware of this. And usually if you do this work, you can tell how, triggered people are or activated they're becoming. So in terms of how I work with trauma, there are many different models. There is a model called EMDR that is very effective, and I don't use that model. But if someone is looking for a trauma therapist, EMDR is highly recommended. A lot of data on it. I just have never actually taken the time to get the training on it. So I'd use a model called cognitive processing therapy, which is, I find it quite effective. It's used at a lot of the VA hospitals in the States. It's got a fair bit of research behind it. It's somewhat similar to cognitive behavioral therapy. That's why I've gravitated towards it. Some of the same ways of working are similar. So for me, it was an easier sort of route. I also use more sort of, we call them somatic therapies, things like mindfulness, where we're kind of helping people calm their system, connect with the body, and work through sometimes a lot of the disconnection between the mind and the body that happens with trauma. Yoga is something that's very much very effective with trauma in terms of helping people, certainly as they're going through trauma therapy or just to recovering from trauma. It helps them stay connected to mind and body. People typically are very disconnected from their body, very much often in their head, sometimes feeling numb. These are some of the characteristic sort of responses that you'll hear from people that have been traumatized. So one of the other things that's really key to trauma to understand that I don't think most people are aware of is that when you become traumatized, you go through a traumatic event, it alters your beliefs. All of us have core beliefs about ourselves, other people, and the world. And typically, if you're walking around the world in a kind of relaxed and calm state, those beliefs are that you are safe. The world is safe, other people are safe. If those beliefs weren't that way, you would be on edge all the time. So for people that have been traumatized, what can quickly change in an instant is, and could be the world is not safe, other people are not safe, I'm just not safe, uh, whatever that may be. That is a core part of what changes for the person. If you think about it, if I'm going out in the world, I'm obviously, and I'm very relaxed, I'm going to the mall later or something like that. I'm not anxious or fearful because I feel safe at the mall. I've been to the mall 100 times. Nothing negative ever happened there. Now, if I was attacked at the mall or something, traumatic happened at the mall, I would not feel that way if I was going to the mall. And the reason would be my beliefs have been altered about whether the mall is safe. Now, we can also have visceral reactions to things. I mean, I remember myself personally in the summer, I had a ruptured appendix and I went to the hospital. And when I went back to the hospital for a follow-up appointment, I could actually feel my system being activated, pulling into the hospital parking lot. Now, I myself mentally was calm and relaxed. My body was responding to going back to this place, which was a place where I had, was quite ill, and it was quite a challenging few days that I was there. There's a lot of this is quite common. Some people who've never had trauma may not be aware of it. So there's a lot of like visceral, physical responses to trauma. Trauma is stored in our body. Our body does not forget the trauma. You have to remember that the number one thing that our brain does is try to keep us safe. Our survival instincts are the most powerful instincts we have, and those are obviously very strongly associated with trauma. So one of the things we found was, in terms of how we look at trauma, it hasn't been really that long that we've looked at trauma this way. Even after the Vietnam War, a lot of the veterans returning who had PTSD, they still weren't really aware of what was going on with them. They often were misdiagnosed with other problems. People that were like drinking and using drugs to cope with the PTSD were just labeled as, addicts or alcoholics. And there wasn't a lot of understanding. Now, there's a theory out there, and I'm not sure if there's any data to support it, but there's a theory that a lot of the people that say were in the Vietnam War that did get traumatized and end up with PTSD had previous childhood trauma, which made them more susceptible to trauma. And that's something else that I want to mention too, is that if you've got a history of trauma, you're going to be more susceptible to being traumatized. You have to be more careful. So it's one of the other things we do is we know that people that are in very supportive family environments, like children, going through traumatic events don't seem to have the same reactions that children whose parents are overwhelmed by those situations and not able to be supportive and present with them. They'll have often higher rates of things like PTSD or trauma responses, seemingly because they didn't get that support that was necessary, which makes sense. If I'm a child in the middle of a war, but I have a supportive, present parent that is helping me feel safe, that obviously makes sense. It's going to lessen the traumatic response to the situation. One of the ways that, or I should say one of the books that has really shaped how I approach trauma is one by Judith Herman. It's called Trauma and Recovery. Now, it's a bit technical, but I highly recommend it. And it talks about these stages that I've really embraced when I work with people, which is the first stage is basically to help people feel safe, give them coping skills in ways that they can feel safe. Once we've sort of gotten those and they're using them regularly and that sort of thing, then we can start doing the work on the trauma. makes sense that if you don't help people have some tools in their toolbox to use when they're going through trauma work, how can you responsibly work with their trauma? People become very activated during sessions, and then afterwards will have to use these coping skills to bring their system down, to relax, to be able to do their day-to-day function in their day-to-day lives. To me, it's very important to me that I don't bring someone quickly into trauma work and just leave them in this kind of activated states where they can't go to work or they can't live properly because their trauma, which has often been buried, I've brought to the surface through talk therapy, and now they're kind of sitting in it and struggling to cope. So the next stage after that would be what we call like reconnection, or you've done the trauma work, you've done the mourning, you've done the sort of recounting what happened, you've processed it, you've worked through it, and then we're getting to a place that we're now ready to reintegrate and to connect with life again, in a sense. Now, going back to what I was saying before, if trauma is going to lead us to feel unsafe, then it makes sense that we're often going to be pulling away from people, avoiding people, not taking risks, things like this, because we're trying to find comfort and we're trying to avoid uncomfortable feelings associated with being unsafe. So certainly somebody that's had a lot of trauma may have a very small circle of friends, may not do very much, is not that active in social settings, and they're not sort of out in the world to the same degree. So part of this, the work and part of the healing, is to help them safely reintegrate into life. So one of the things, and I don't want to get too technical here, but one of the things that happens with trauma is it's manifest more in like our implicit memory. So people that have had trauma often have, like, rather than an episodic sort of storyline kind of memory of, oh, this happened, then this happened, then this happened, their implicit memory will be more about, they'll have like they'll remember a color of a shirt, or some sort of image of the side of a car, or the look on someone's face, or what, whether it was raining or sunny that day or something. They have these kind of fragmented pieces that can come to them, and often they can be quite distressing. It could be a person that was just incredibly angry the moment before they hit you, and that's what you remember. So these memories that resurface can be quite distressing for people. And I don't think the average person sometimes realizes that they're not experiencing it in a sort of sequential storyline, episodic way, like other memory as we typically think about remembering something. So one of the things that can happen, when most people are familiar with the term triggered. So if a person is, say, walking down the street, let's say they were attacked by someone a few years ago. They're walking down the street, they see someone that their sensory input identifies as something similar to this person that attacked them. Could be a similar shape, similar age, the outline of them could be similar, whatever it is, it'll then trigger the amygdala. There's a threat present, and their system will get activated, and they'll get very triggered, very overwhelmed, very anxious. The hormones are being released, and what they can often do in those situations is what we call disassociate. They can sort of leave their present self and go into sort of this, we call it disassociation. So they're in this kind of disassociated state. They're not fully present. So one of the ways we help people who have trauma, who are being triggered periodically, is they learn what we call grounding techniques, where they can focus on things in their immediate environment, sort of things they can touch, things they can see, things they can hear, things they can smell. We get them to actually name things in their environment. There's 3 blue things in my room, or 5 things I can hear, whatever it is. It helps us then go out of this disassociated triggered state to then be more present, and then of course our system will relax. So that's one thing that people typically have to learn. It's very helpful for them, is these grounding techniques. So one of the things I used to do when I had the office was clients would rub their hand on the rough sofa arm, and that would help them stay. It was like a tactile grounding, would help them stay grounded. So as they were recounting things or sharing things with me. The other thing that's pretty key with trauma that you see is traumatized people can often hate themselves and be struggling with shame. Sometimes they blame themselves for some aspect of what happened to them, that they didn't tell anyone, or they didn't stop it, or they didn't avoid it. We see this, it's very common in sexual trauma, especially for younger people. And there's a lot of sort of irrational beliefs around it. So somebody who's 6 years old, who is abused by an adult, could feel that they should have told someone, or they should have called the police or something, which is obviously not realistic for someone that young. So part of helping them reprocess and understand it is often part of helping them understand the context by which it took place, and the fact that they were victims, or they were young children incapable of doing much. So a lot of when I started in the field about 20 years ago, it wasn't that common, but over the years, especially the last 10 years, trauma-informed care has become much more popular. And the reason for that is simply that without the understanding of looking through the trauma lens, you can misdiagnose, misunderstand what's happening. One of the common ones I find is that someone who's had a trauma history, usually childhood trauma, people will think they have ADHD because they have trouble focusing, when typically it's their childhood trauma that's not been worked through. So the problem is, if you try to approach it as ADHD, you're just not going to get anywhere. It's the same thing with anxiety. If the anxiety is really rooted in a previous trauma, then it's going to be difficult to make any sort of progress. Anger and depression are quite common with trauma. And there again, unless we have this trauma-informed perspective, and we're asking those questions, we're not going to really understand what's happening and be able to properly help people. Now, the other term that's more recently become more, we've become more aware of, is what we call intergenerational trauma. We've actually shown through studies that previous generations that have been traumatized can pass that on to the present generation. Of course, the other more obvious way that it happens is that traumatized parents have trouble being effective parents, and then, of course, don't validate, support, nurture. They're not there for their children in the way they need them, so they grow up having challenges of their own. Many children feel shame, have difficulty with their identity. Certainly parents that are exploding and critical and yelling, and who are often themselves been traumatized and never done the work. It certainly doesn't make for a healthy childhood. Now, one of the other things, I'm jumping around a bit here, but aside from just helping people feel safe, we also have to typically help people learn to love themselves and have some self-compassion for themselves. Often people that have been traumatized feel unworthy of love. As I said earlier, may hate themselves. So a lot of the work is around changing that, because if that doesn't change, they're not going to have the quality of life. The other thing, too, to be aware of with trauma is that we typically realize is that, we have to be very realistic at the progress we're going to make, because we can't push people really quickly through any sort of treatment. It's going to take time. If you push people too quickly, they'll become overwhelmed, and it's obviously counterproductive. So you have to be sensitive. If I work with couples and one of them has had some trauma, we have to go slow. We have to be more sensitive and careful. And typically any therapist, once they identify there's trauma, would take that approach. So I say that especially too. So if people are looking at seeking help, one of the things we encounter a lot of times is people think, oh my gosh, I'm going to go in there and Jim's going to make me talk about all this stuff, and it's so scary and overwhelming, but he's going to force me to talk about it. And it's not like that. First thing I tell people is we're going to go at a pace that you're comfortable with, and we're going to stop when you want to stop, and we're going to talk about something else when you want to do that, and no one's going to make you or push you at a pace you're not comfortable with, because that's how we help people feel safe. That's how we help them feel seen and heard, and how we care for them. So if you've been seeking help for things like anxiety or ADHD, or you're just having general difficulties in relationships, having trouble being vulnerable, you may find yourself having exaggerated fears. It could be something from your childhood you're not necessarily aware of. Sometimes we bury things or trying to block them out of our conscious awareness for very good reasons, because it's overwhelming. So it may be something that you could consider, perhaps even listening to this podcast. Some things have surfaced for you, which is very common. And you might want to then seek out a therapist to have a chat. Typically, I recommend people find a therapist, of course, is trained in trauma or a certified trauma professional. It's just that extra training is really important. It's for me, I'm not sure. I did a lot of training to work with couples, a lot of training to work with trauma. I'm not sure which I did more of, but it's certainly far more involved than the other work I've done around, say, things like working with anxiety. So one of the other things that I thought I would mention that I often use to identify if someone's been traumatized is this, what we call it, being chronically busy, or sometimes we label it as an overfunctioner, a person that's unable to relax, constantly busying themselves. Some of that can be because they feel more valuable, or they feel they have more purpose if they're busy, or it can also just be a way of just almost in a sense running away from this challenging past by being constantly working or engaged in activities. And usually when you talk to someone, it's very easy to see that they're kind of, as we would say, over-functioning. The other thing we would notice is somebody has difficulty being vulnerable, as I mentioned earlier. They might be emotionally unavailable, shut down. They might feel numb. One of the name of my podcast, From Surviving to Thriving, kind of really resonates with a lot of people that have had trauma, because they're going to work and they're doing what's necessary. They're surviving, but they're not thriving, and they're not feeling fulfilled. They're not really enjoying their life. In fact, their life often feels kind of devoid of joy and pleasure. And that can often be rooted, of course, in the trauma, taking that from you. So a couple of books, I mentioned one earlier, Trauma and Recovery by Judith Herman, I highly recommend. But one that's a bit better for this sort of, it's less technical, I'll say, is one that is very popular. A great book, The Body Keeps Score. Uh, mind, body, and brain, mind, and body in healing of trauma. It's by Bessel van der Kolk. He's a physician that works in, or perhaps he's a psychiatrist. He works with trauma in the States, I believe, as a trauma institute. It's a wonderful book. Talks a lot about practical things you can do. Talks about different models that are very effective. It has a big chapter on things like EMDR, yoga, even things like they found people that are involved in drama and plays that there's an effective way of working through trauma. So if any of this kind of resonated with you and you think that you may have some previous trauma that that has not been treated, that may be a root of some of your problem. One of the biggest problems I find that with this particular topic is people will look at experiences and say, oh, well, that's not really trauma. And they'll dismiss, even though they may feel that it was an overwhelming incident, they'll dismiss it as, oh, well, I didn't get this. My first girlfriend broke up with me. That can't be traumatic. But, things affect people differently, right? So, and some people are much more sensitive. So we don't want to judge other people or ourselves and say, well, that's not traumatic. Of course, we know the typical, someone in a war zone or someone who's being mugged who thinks they might die. We're used to those situations. And of course, most people would recognize them as traumatic. But the 90% of what I work with people is not situations like that. In some cases, people, it's something they don't even think is that significant. So one of the things I should have said in the beginning that I didn't, and I'll finish off with this, is one of the ways to kind of zero in on trauma in terms of these events is asking yourself, after that situation or event, was I different than I was before? And most people, that's usually how I ask people, most people will say, oh, yes, I did feel different after that situation. And usually it's fairly profound. It's not like, oh, maybe it's more pretty. They're able to see, yeah, I was quite different afterwards. There's a little kind of phrase saying we have in trauma that is very helpful, is that when children are born, they're wired for connection. But after we become traumatized, we become wired for protection. And that's why a lot of the behaviors, as I've mentioned through the podcast, are associated with staying safe, not being vulnerable, avoiding. Avoidance is probably the number one thing we see with trauma. So those are the behaviors that clue you into, like, I'm trying to stay safe, and are often our immediate reaction to self-soothe and feel safe is to avoid. But in many cases, it's something that creates more problems. Same thing with anxiety. You don't want to be avoiding anything that makes you anxious. Your anxiety problem will become much worse. So hopefully you found this helpful. I always welcome any feedback, any questions, even any sort of suggestions for topics. I'm always open to that, and hope you take care.